Evening. Old is gold wisdom family. 5 health checkups you should avoid after the age of 70 because they may cause more harm than good. There is a hidden reality that many seniors never hear directly from their doctors. Each year, millions of older adults go for health screenings believing they are reprotecting their health. But what if he told you that some of these tests, even the routine ones your doctor recommends, could actually increase your chances of surgery, stroke, or even cancer? Recent research shows that up to 37% of medical tests in seniors result in unnecessary triads, complications, or permanent side effects. Even more concerning, 99% of people over 70 don't realize they are being over-tested. One test on this list, ranked number 1, is linked to 5% of alcohol cases in the United States, which is the same number of cases caused by daily alcohol consumption. You won't hear this in most clinics. You won't see it advertised, but the truth exists in scientific research. And today, we are revealing it. In this video, we'll cover 5 health checkups you should avoid after 70 and the serious impact they can have on your body. Everything is backed by real science, and what ranks number 2 may surprise you. Before we start, tell us in the comments where you're watching from, your age, and whether you've ever regretted a test or medical procedure. Do you feel seniors are tested too often? We read and respond to every comment with personal tips and guidance. And don't forget to like this video and subscribe for more content like this. Now, without further delay, let's discuss the first test and why it seems harmless but can slowly damage our quality of life. Checkup number 5. The bone density scan. It appears harmless. It's quick, painless, requires no injections, and you leave with results about your fracture risk. But here's what most people aren't told. After the age of 70, a bone density scan often creates anxiety without real benefit. This test, known as ADXASCAN, measures bone strength and is mainly used to detect osteoporosis. However, in older adults, especially women, results almost always show lower bone density, even when there is no immediate danger. That's because bone loss naturally occurs with aging. Just like gray hair or wrinkles, it happens to everyone. Yet many seniors are placebo medications, such as bisphosphonates, designed to strengthen bones, but Linchetto's serious side effects, like gonocrosis, a rare condition where the jawbone begins to deteriorate under irritation of the esophagus. Here's their issue. Research shows that treating mild bone loss in people over 70 with medication has little effect on actual fracture prevention. A study published in the Journal of the American Geriatric Society followed more than 1,200 women over 70 and found that bisphosphonate tests fracture risk by just 0.3% over 5 years. That's not zero, but it's far from life-changing. Meanwhile, those women were much more likely to experience side effects such as digestive problems, esophageal inflammation, and unusual bone fractures. Let me share this story of Rose, a 76-year-old retired piano teacher who was sent for a DEXA, her yearly checkup. She had nevertheless had no pain and walked daily. Her results showed osteopenia, a mild decrease in bone density that is not the same as osteoporosis. Her doctor quickly prescribed alendronate, a bisphosphonate. Within 3 months she developed severe acid reflux and jaw pain. By the time we saw her, she hadn't touched the piano for weeks. We stopped her medication and instead put her on a plan that included vitamin D, weight-bearing exercises such as resistance bands, and a calcium-rich diet with foods like sardines and leafy greens. 1 year later, she returned toppling recitals with stronger legs, improved balance, and no fractures at all. A quick scan may feel like a wise choice, but for adults over 70 who are not falling or breaking bones, lifestyle changes are often the better solution. Strength training, balance workouts, proper nutrition, and correcting vitamin D deficiency have been shown to reduce fracture risk by more than 20%. According to a 2022 study in osteo, don't allow a single number on a screen to push you into a treatment you may not actually need. But there is another scan that can let out something far more frightening: brain surgery. Checkup no, for let's discuss that next. Number 4. Brain MRI for memory concerns. When older adults notice increased forgetfulness or confusion, the natural response is fear. Fear of dementia, fear of Alzheimer's disease. As air salt doctors often order a brain MRI, but here's the difficult reality. Mr. Izzy, which are detailed images of Thebron's structure, rarely provide the clear answers patients expect. In most people over 70, MR is simply shower-related changes, such as mild brain shrinkage or white matter spots that are completely normal in aging adults. Here's the problem. Once these spots are identified, they can start a chain reaction of fear, additional testing, and even surgery. Surgery that may not improve memory and can sometimes make symptoms worse. In 2021, a study published in Neurology Today reviewed over 3,000 MRI scans in patients aged 70 to 85 with mild cognitive concerns. 86% showed some type of brain abnormality. Yet only 3% of those findings were connected to a truly treatable condition. That means 97% of patients experienced distress of being told something was wrong when, in reality, it wasn't. Even more troubling, nearly 12% were referred for invasive procedures, such as spinal taps or even exploratory biopsies, all based on scan results. Consider George, a 74-year-old retired engineer who came in worried about his memory. He was still sharp but misplaced his keys, often, and occasionally forgot names. His doctor ordered an MRI that revealed white matter changes. He panicked, convinced he had dementia. He stopped bedriding and stopped attending church. Over the following months his anxiety intensified. However, when we later evaluated him with a standard cognitivist, his score was completely normal. We explained that the MRI findings were appropriate for his age. We helped him focus on lifestyle steps like better sleep, proper hydration, and brain exercises. Within 3 months, his memory stabilized, and he felt like himself again. The truth is, unless there are serious neurological symptoms such as seizures, sudden personality changes, or rapid loss of function, an MRI is rarely useful for mild memory issues. A better first step is a cognitive screening test, a simple paper assessment that measures memory, attention, and problem solving. It is affordable, effective, and helps avoid unnecessary fear. Now, prepare yourself, because the next test on this list is one you've likely had many times. Checkup No. 3, and it holds the number 3 spot for a reason. Number 3. Cardiac stress test. It's one of the most frequently ordered tests for seniors who report mild tiredness, slight chest pressure, or simply feeling less energetic than before. The cardiac stress test, a procedure that tracks your heart while you walk on a treadmill or receive medication that mimics exercise, is designed to detect blockade. But after age 70, this test often causes more harm than benefit, especially when used in people without clear signs of heart disease. That's because it can trigger false warnings and lead to unnecessary heart procedures that come with serious risks. The main issue is accuracy. Research shows that in adults over 70, the false positive rate for stress tests, meaning the tests exists a problem when none exists, can reach up to 40%. This often leads to follow-up procedures such as angio, even unneeded stent placement or bypass surgery. In 2017, a large study published in JAMA Cardiology reported that more than half of all stents placed after stress test referrals were done in patients who had no true symptoms or measurable benefit. Those patients saw no improvement in survival or quality of life, after the procedure. What they did experience, however, were higher rates of bleeding, kidney damage from contrastes, and longer hospital stays. This opened to Raymond, a 75-year-old retired postman who stayed active by walking daily. During a routine visit, he mentioned he sometimes felt tired when walking uphill. His doctor ordered a stress test as a precaution. Their results were unclear, so he was sent for a catheterization, a test that places Atabay into the arteries to look for blockages. A mild narrowing was found, and the stent was inserted. That night, Raymond reacted to the contrast dye and developed kidney complications. He spent 6 days in the hospital and required weeks of follow-up care. His fatigue never improved because it was never a heart issue in the first place. He was simply an older adult who needed better hydration and more rest between meals. If you are over 70 and do not have a classic heart symptoms such as chest pain during activity, shortness of breath with exertion, or a noticeable drop in energy during light exercise, then a stress test may cause more harm than good. A better alternative is often a resting EKG, which measures heart rhythm while you are still, or a coronary calcium scan, a low radiation imaging test that shows whether harmful plaque is forming. These options are safer, simpler, and far less likely to push you into a checkup. No to a procedure you never needed. Number 2. Colonoscopy. This one may surprise you. The colonoscopy, a procedure that uses a long camera to examine the colonized notoways, a smart choice after age 70, and is rarely advised after 75 unless there are specific warning signs. The risks increase with age. The preparation is difficult, involving strong laxative sedative can cause dehydration, dizziness, or kidney problems. The sedation used during the procedure adds extra risk to brain function in older adults. And most surprisingly, the test itself can lead to complications such as bleeding, tearing, or heart rhythm issues during sedation. A 2019 study in JAMA Internal Medicine followed more than 1.3 million Medicare patients aged 70 and older. Researchers found that for every 1,000 colonoscopies performed in patients over 75, only 2 lives were saved, while more than 20 people suffered serious complications. That's a 10-to-1 risk-to-benefit balance. And even when polyps are detected, many are small and slow growing. Removing them in an older adult can sometimes cause more harm than leaving them untreated. Dana was a 73-year-old grandmother who managed Asmal Bakery with her daughter. She had no symptoms, no bleeding, no changes in bowel habits, and no family history of colon cancer. However, her new primary care doctor, recently out of residency, strongly recommended a screening colonoscopy. She agreed to proceed. During the exam, a small polyp was removed, and she was sent home. That night, she developed severe abdominal pain and fainted. At the hospital, Tessa revealed a bowel perforation. She spent 9 days recovering, lost 10 pounds, and has never fully returned to her previous health. When we reviewed her medical history, we discovered she had already undergone 2 normal coloscopies in the past. There was no clear reason to repeat the procedure. The U.S. Preventive Services Task Force NO recommends stopping routine colon cancer screening at age 75 for masked individuals. For those in excellent health, a stool-based option like the FIT test, a non-invasive at-home fecal test, is often a safer alternative. It requires no preparation, no sedation, and still identifies most serious cases. Ask your doctor about other options, because once you enter the colonoscopy pathway, it can be very difficult to exit. And now we've reissued the most overused, most risky, and most harmful checkup for older adults. And there's a strong chance you've already had a checkup now. Number 1. Annual full-body CT scans. Full-body CT scans sometimes offer read-through executive health programs or as preventive services at private clinics, are promoted as a way to detect cancer early. But here is the alarming truth. These scans expose the body to high levels of ionizing radiation. For adults over 70, the chance of triggering GUNA-CC follow-up tests, biopsies, and even surgeries is extremely high. Ironically, there is no evidence that full-body scans in people without symptoms actually save lives. Each scan delivers roughly 10 to 20 millisieverts of radiation, equivalent to about 500 chest X-rays. According to a 2023 modeling study published in JAMA Internal Medicine, the increase in CTC scan use across the United States may now account for up to 5% of all cancers, placing them on the same level as alcohol as a cancer-causing factor. That 1 out of every 20 cancers could be linked to a scan that was intended to prevent an illness. That's not just infective, it's deeply concerning. These scans often detect harmless nagules calcifications or cysts that are simply part of normal aging. Mutants. They are identified, alarms are raised, additional scans follow, then biopsies, then anxiety. Let me tell you about Marcus, an active 80-year-old who's taught martial arts to other seniors. He felt healthy and enrolled in a premium senior screening at a private clinic. His full body scan revealed a tiny 3mm nodule that set off a chain of events. He was sent to oncology, referred for a PET scan, and eventually underwent a needle biopsy. The result was benign, but the biopsy caused part of his lung to collapse, leading to hospitalization and a 2-month recovery. All for a finding that could have been safely left alone. Medical experts now advise that full-body CT scans should never be used for routine screening in adults without symptoms. The American College of Radiology is very clear. There is no proven benefit and a significant risk of harm. If symptoms such as unexplained weight loss, coughing up blood, or visible swelling are present, then focused imaging is appropriate. But scanning the entire without a clear reason is like looking for treasure using a lens detector. You might find something, but damage can be worse than the problem you were trying to prevent. A safer and smarter approach is paying attention to your body. If you feel well, continue regular visits with your primary doctor and only undergo tests that are clearly necessary. Your time, energy, and health are too valuable to spend on fear-based screening that may leave you worse off than before. So there you have it. 5 checkups that may appear helpful but can actually cause harm, especially after the age of 70. Modern medicine is powerful, but it is not flawless. In many cases, less truly is more. Alwasisk. What comes next? If a test finds something unclear, or if the risks outweigh the benefits, it may be time to pause. And remember, true prevention begins with lifestyle. Stay active yet nutritiously, sleep well, and choose your medical tests carefully. Now we'd like to hear from you. Have you or someone close to you ever experienced complex cysts from a medical test or treatment that later proved unnecessary? What happened? Share your experience and thoughts in the comments below. We would love to read them. Thanks for watching. Take care. Old is gold was